From Manhattan, this is the New York Executive Podcast. The voices that move markets, the conversations that shape the boardroom. Live from our studios in Midtown New York City, here is today's program.
And welcome back, everybody. If you found us, there's probably a reason. You were searching, typed in a couple of, we call them keywords, and we popped up here. And if you are here, a pretty good chance that you're dealing with these challenges. We all have had them. You're going to relate, whether it's bloating after you eat, constipation, maybe you've got reflux, maybe it's just your stomach just feels uncomfortable. That, and if you're a woman, and maybe you're in the middle of your life and this stuff has started showing up and you're thinking, what happened? Maybe I'm allergic to something. Maybe I have an intolerance all of a sudden. Let's learn about this. She is a holistic physician with decades of experience helping hundreds of people essentially restore their gut health. It's so important, and I'm looking forward to talking with her. Dr. Nancy Lach is on the program. How are you today?
I'm doing great. Thanks, Steve.
It gets all of us at some point. You know, you can run, you can't hide. We're all going to have some kind of issues from time to time. And there's so many different reasons for those gut issues to come up. I want to start here with women and why in the middle of their lives do things change with digestion? What's going on there?
Mm-hmm. Well, first of all, I just want to share that the reason why I'm focusing on gut health with women is because I get really frustrated seeing so many women suffering needlessly, not getting answers, especially, for us women in midlife. I myself are 65. Oftentimes we're the ones that have raised the kids. I mean, of course, men help, our husbands help a lot. We have the kids, we raise the kids, we oftentimes have careers, dealing with a lot of stress. And by the time we get into midlife, our 50s, 60s, 70s, it would be real nice to be able to be feeling good and be able to enjoy our lives and socialize and enjoy our food, be able to travel without having all these nagging gut issues. And the fact of the matter is, women are affected twice as much as men for gut issues. And a lot of that is because of our hormones that we've been so blessed with, so we can have children and whatnot. But as hormones, the estrogen and progesterone decrease, it actually affects our gut. It affects how food moves through the gut, how we eliminate. And that also affects our mood, our energy, our sleep, and, so many things. So myself, having been through my own gut challenges, even as a health practitioner, which maybe we'll have time to discuss, I want to be able to help others, as I've done in 20 years of practice. And so in my office, I've seen so many people who were not given hope transform into a life that they now love and they can enjoy, and they don't have the gut problems that they were told sometimes they just would have to live with, and it was due to age, whatnot. And I'd like to share this with more people. So through now coaching in a remote venue, I'm able to reach even more people.
I want to hear your journey, how that all started. Walk us through that.
Yeah, absolutely. So like I said, now I'm 65, and in a lot of ways I'm in better health than I've been in a long time. My gut no longer bothers me. I'm comfortable going to the bathroom, have normal, all that stuff going on. I can travel, can eat, know what foods I do well with and all that. But honestly, I mean, Steve, and to all your listeners, it wasn't always this way. I struggled about 30 years ago after the birth of my third child. I have 4 grown children now. After my third child was born, I started having these really bizarre gut issues. And I didn't know what food it was. If it was from food, I would eat. I'd be afraid to eat. I'd get these really terrible pains in my gut that would travel into my back. It was bizarre. And here I was, a health practitioner, already practicing as a chiropractor for a number of years, thinking I knew, a couple of things about health and nutrition. and I didn't know what the heck was going on. It was really debilitating. I was like, how am I ever going to be able to travel, visit my family back east? I'm actually from New York. And how am I going to travel? I love food. I was literally afraid to eat. Terrible bloating. I'm sure a lot of your listeners can relate. The bloating is so common, and it was just really, really awful until I found someone who then could coach me through what I needed to be aware of as far as the things that I was consuming,
Mm.
and walked me through that journey so that I was able to work with someone that supported me so that I can get my life back. And it was quite the journey. And that's now I feel like I'm so empowered. Sometimes we go through things as physicians. I've gone through a few things that actually helped me be a better practitioner and being able to understand the suffering and the struggles that go on with, in this case, with gut issues.
Obviously, I'm not a woman, but I got to tell you, I can relate to the things that you just said in terms of the issues. Had diagnosed with an ulcer about I don't know, 10 years ago or so. And it still comes up every once in a while. I know it's from stress. I'm bringing that up because what you said before about you were feeling these things and then in your back, it's amazing how when you have stomach issues, that the pain shows up in other areas.
Mhm.
And even in your chest, you might feel like, oh, maybe I'm going to have a heart issue. And I would feel that, and I would take my fingers and just firmly press at the end of my esophagus where it meets the stomach. And I was like, oh, that pain went away for a second. All right. So it's not the heart.
Yeah, yeah, it's
Or you,
scary.
it's
Yeah, it
scary. Or,
gets really scary. And that's called referred pain.
uh,
And, as a physician, we learn there are certain areas, certain organs that actually tend to refer to certain areas more than others. It's very interesting, and it's a
mm.
really important understanding of the body.
Yeah, but the challenge in lies here when you're feeling that referred pain, and then your mind takes over. It's like, well, maybe there's something up here. Maybe this is, maybe that, maybe that. And then what happens? Your stomach gets worse because it's freaking out. You're stressed. You have anxiety from that referred pain or that pain in general.
Yeah. Yeah. And then people will go, to their doctors as they should. But unfortunately, oftentimes is, thousands of dollars worth of tests and try this, try that. And
Yep.
I know a lot of my patients and clients now, my coaching clients, they don't want medication thrown at it. They want to get to the underlying cause. And those are the people that I work with because my passion is getting to the underlying cause. I mean, originally I was going to be an MD all through college. I was pre-med. And then I wanted more of a holistic education, so I became a chiropractor. That still wasn't enough. There's still reasons for neck pain, back pain that are actually related to organ dysfunction and nutritional deficiencies. So that's what I've been doing for the last 20 years is personalized, um, custom designed programs for people to address nutritional deficiencies, organs that need support, and then the guidance and the tools to support people so that they can be empowered to be able to really take back their life, trust their bodies again, and know that their bodies can heal. And that's what this, my holistic gut reset program is all about, walking that walk with people and really empowering them so that they have the tools that they need to be able to not only get over their symptoms, address the underlying issue, and enjoy the rest of their lives.
So you mentioned nutritional deficiencies. Can you define that? And do we all have that going on?
Well, unfortunately, the state of our food, unless you're growing your own organic food in your backyard, which is ideal, which
Mm.
we've started to do here. My husband's a great gardener. And even if you have an apartment, you can grow your own food. My son lives outside of Portland, and he has a terrace of his apartment. He just sent me pictures yesterday. Beautiful plants growing with food on them.
Wow.
So, but getting back to your question, unfortunately, most of the food that we buy at the stores are deficient in the nutrients that we need. So the soil is where all the minerals come. The food has the vitamins. So I coach my clients to get the best food possible, and it's possible to do that without spending a fortune. To try to rely on more organic, of course, is better, and to eat a variety of foods so that they can get the nutrition that they need. Sometimes we get stuck in a rut, and that's where a coach comes in to help kind of get you out of those habits that are keeping you where you're at, right? Because we all know if you keep doing the same thing, you'll keep getting the same results. So to help guide people very gradually really is the key, without stress, towards getting getting more nutrition and overcoming nutritional deficiencies, primarily through food, really is the best way to do it.
It seems also that you would direct us into being more curious about what we're eating, labels, things like that. Do you arm the people you work with
Oh,
that info?
absolutely. Absolutely. As a matter of fact, in my holistic gut reset program, I have some specific tools. One of them is a food journaling system that I've
Mm,
developed. And I have my clients journal what they're writing. And then, no judgment, no guilt, just, hey, everything you're eating, none of us are perfect, including myself. I did this myself as part of my training. And I thought I was already eating healthy, and it helped me a lot. And so through this food journaling system, then we look at what they're eating. And again, we gradually start talking about, okay, instead of this, you can have that. I'm not into denial, like don't eat this, don't eat. I don't like that because I really like my food. Don't tell me what I can't eat, right? And so it's more about, hey, instead of this, why don't you try that? Or a little more of this, a little less of that. And even I've even had, clients that thought they really hated salad. And I just encourage them a little bit. Within a week or two, they're like, you know what? I'm really surprised. I'm really enjoying my salads. So our habits can be changed relatively easily when we have some guidance. And then those things over time, when we work on that together over time, it just becomes the way you live. It's not a diet. It's not restriction. It's just a better way of life that, frankly, Steve, once people start embracing and doing those things that support their body, then it's a wonderful reinforcement, because then you're feeling better. And when
mm.
you do that, you're enjoying life, you're able to exercise and travel and go out, you have more energy, you're sleeping better. Who wouldn't want that? So we do those things most of the time, we're going to be enjoying life. And it doesn't mean we have to, we can never have that piece of birthday cake or go out for a special occasion or dessert. We can still do that. Yet what we do most of the time really fosters that vitality that, we all want.
Even the suggestions to change it up, like you mentioned, salad. I got bored after a while of eating salad, and then one day I'm like, oh, let me throw some strawberries in there. Whoa, big difference. Throw in a couple of apples, whatever it is, just change it up a little bit.
That's
But
right.
when we're stuck in that rut, especially if we don't cook, or we're not, as active in cooking as many others might be, you're not thinking of those things. It's amazing how we've been programmed in terms of our food, from advertising, marketing. I mean, going back to the beginning of processed foods, I'm understanding that goes back to the 1930s, and the first processed food that they told us was healthy was cereal, breakfast cereal. Yeah,
Hmm.
like, okay, cornflakes, it's good. Start your day. All right, there's maybe some health benefits there, but by and large, it's all processed. What are your thoughts?
Absolutely. Yeah, it makes me think about in the 70s, was given TV dinners, right?
Same.
And before that, it's white bread, the best thing since white bread, sliced bread. And the fact of the matter is, cultures years ago that were more isolated, that ate whole real food, were really healthy. And then when they started bringing in refined flours and refined sugars, that's when people started having arthritis, birth defects, you know, tooth decay. I mean, you name it, all these different diseases, because the body started breaking down from the inflammation caused by these foods. So again, it doesn't mean we can never have a treat or desserts. And, there's lots of ways to make things healthier also. But you make an excellent point. that our food really has not served us. And I think though a lot of people are wising up and getting back to more wholesome foods. I mean, we've got full grocery stores now dedicated to organic, the produce section is all organic. There's a lot of opportunity, not everywhere, but many places, and people are really seeking out healthier choices because people are really smart these days. Honestly,
Mm.
we've got a lot of very enlightened people that they're not just going to follow, oh yeah, cornflakes or, I had Captain Crunch when I was a kid. I mean, my husband and I laugh about that kind of stuff. It's like, dang, we grew up, eating all this junk
Yeah.
and it really takes a toll, and it's taking a toll on society on many, many, many. I mean, look at disease in this country, diabetes, heart. I mean, when the EKG was developed, they were like, I don't know, why do we even need this? There was no heart disease. Now it's used,
Mm.
right? Now heart disease is the number one killer. So, I mean, it really all does boil mostly down to our food. And the good news is that our body is designed to heal, even if we haven't been doing the best for it. And I've seen this in the last 20 years over and over again with hundreds of patients. And now my coaching clients, that when you start doing what the body needs to really thrive, it really amazes me over and over again how quickly people start feeling better and their symptoms just kind of start melting away.
Do you
So
believe that our bodies are so amazing that they can heal ourselves? We can heal ourselves.
absolutely. Our bodies were designed to heal. I mean, we all know if you have a little cut on your finger in a few days, it's going to heal up. That happens on the inside too.
Mm.
So we have to remove the interference. Okay, so that's a lot of what I did as a chiropractor, removing the misalignment so that, the muscles can relax, the nerves can flow. And then working in nutrition, it's working with, do we need to clean things up? Sometimes people need a little cleaning up, cleaning out those toxins or poisons, and there's different ways of doing that. And then supplying the body with the very nutrition that it needs through salads, vegetables, fruits, whole grains, like all the real wholesome food that was put on this planet for us to eat. It's there for us. Our body does heal. I see it over and over again. Even people that were told, you're just going to have to learn to live with this.
Mm. It's amazing when we think about what we eat, all this processed food, and what our stomachs are doing. Like,
Yeah.
I can't imagine if your stomach could talk. It's like, what did you put in here? I got to work triple overtime to get this all done, processed, and all of it. And you've heard this. I think it was Socrates said it. Food is thy medicine.
Yeah, let food be your medicine. Yep.
So when you think of that phrase, would you ever pick up the phone and call the doctor and say, Doctor, I'm going to eat some chips right now. So I want to make sure what the dosage should be, what if there's any interactions, how often I should take these chips. We don't do that. We just eat them. We don't even give it a second thought. But maybe we should reapproach the way our
Right.
relationship with food.
Yeah, exactly. And it really, people really need to take this into their own hands because unfortunately, as wonderful as medical doctors are, and believe me, I really value what they do for people, nutrition is just not in their wheelhouse. They get maybe 15 to 20 hours in their whole medical education. And so it's just not, I mean, we all know you go to the doctor. Sometimes now, some of them are talking more about diet, which is really great, but oftentimes it's a pill for a symptom. And so, and sometimes people need that, and surgeries are life-saving. And so that's amazing. Yet when you've got something that's like the bloating, the constipation, the acid reflux. And sometimes it's not constipation. Sometimes I've had, sometimes many people are going to the bathroom frequently, loose bowel movements, running to the bathroom. How can you enjoy your life when you need to have a bathroom nearby at all times? These are the things that I'm really passionate about helping people so that they can enjoy their life, so that they can get together with friends or travel here and there and not be concerned about where a bathroom is, or they travel and they get so constipated they feel awful for days. People don't realize brain fog, moodiness, and I mentioned the sleep and energy. A lot of that comes from the gut because our gut is foundational to all the rest of our systems. And honestly, it's one of the easiest systems, I say easy, but easier than others to address and heal because we have access to it, right? In the mouth. I mean, we put things right in there, and it's a very involved system, and
Mm.
it takes very personalized care because we're all different. And it is, you mentioned this earlier, it's confusing. It's the whole field of nutrition is very confusing. One day one thing is good, the next day that same thing is bad. It's really confusing, and it comes down, and this is how I work with people, very, very personalized care. In my program, it's like, which foods are right for you? You know, is it even a food problem? Sometimes it's not a food problem. Sometimes you mentioned our stomach, our stomach, our liver, our pancreas, all these organs are actually very, very important to be functioning correctly for our food to digest. So we pinpoint that when I work with people, and I support their organs through whole food supplements, sometimes different foods, so that their digestive organs start serving them better. And it's really important.
Do you find also, you talked about reflux? I've heard, and I'm just curious if you've heard this or your thoughts on it, that our first go-to is, oh, too much acid production in the stomach. That's where this is all coming from. That's why I'm having this reflux, blah, blah, blah. I heard that it can very, very well be the opposite, not enough acid production. What are your thoughts?
I'm so glad you brought that up. I find myself explaining this a lot. So our stomach requires acid, right? We have hydrochloric acid that's secreted by the stomach. And you're absolutely right. When our body does not have our stomach does not have enough hydrochloric acid, it does not break food down properly. That food just kind of ferments and, I'll just say, rots in the stomach.
Mm.
That rotting food secretes inorganic acids, a little bit different type of acid. Still feels like acid. That's what comes up into our esophagus and gives us that acid reflux and heartburn. And so that is really important to understand because it's not enough acid. And the really sad thing is that so many people are put on antacids that really, excuse my French, really screws up their whole gut because now they're getting less acid and the body cannot do its job. I've helped people reverse that and rebuild their guts and heal their gut lining. Fortunately, the gut lining is very similar to like the inside of your mouth. It heals up pretty quick. We all know we bite ourselves. It heals up quickly. It's the same tissue on the inside of our gut. So fortunately, it can heal. And, every 30 days, we have kind of a new stomach lining. Our body regenerates at different rates. The stomach is one of the quickest. So
That's it. That's encouraging to know in terms of how, excuse me, how long is it going to take to heal? We have so much to talk about. We're out of time for today. How does a woman connect with you?
Okay, so the best way to connect with me is through my website. It's Dr. Nancy Lach. So it's DrNancyLach. Excuse me, let me tell you it's Dr. Nancy Gut Health. I made it easier. drnancyguthealth.com. Okay, my last name is like drnancyguthealth.com. And there is a link to my calendar with an offer for a complimentary, and these are limited, a complimentary gut reset session. This is a half an hour session where I get the opportunity to know you better, to find out what you're struggling with, talk about your struggle, and provide you some tools. I usually spend about 10 or 15 minutes within that half an hour providing you with some tips and a little mini plan. And from there, we talk about whether or not it makes sense to do more work together or not. And so it's really important for me to only be working with people I truly feel I can help. And through this complimentary gut reset session, that's what we discover together. And of course, I answer questions and I work remotely, so it doesn't matter where you are. And so you can head on over to my website when it's convenient for you, Dr. Nancy, Nancy, guthealth.com. Find my link, read a little bit more about me, and you could shoot me an email from there. And it would really be my honor to sit down and spend some time with you to find out what you're struggling with, to see if the goals that you have are things that I feel that I can provide for you or not, and then see if it's a good fit to do more work together or not.
Starts with a conversation. And guess what? Life can get better. You can actually get on a plane, feel comfortable about that if that's the challenge.
Absolutely.
Life-changing. Thank you, Nancy, for being here today. So much more to talk about next time we get together. I'm looking forward.
Great. Thank you so much, Steve. It's been a pleasure.
Likewise.
You've been listening to the New York Executive Podcast, broadcasting from Manhattan to 30,000 channels nationwide. To learn more, or to bring your brand to our audience, visit nyexecpod.com. We'll see you next time.